Hello, everybody. My name is Pablo Boczkowski. I'm a faculty member at Northwestern University and the director of the Center for Latinx Digital Media. Thank you so much for joining us for today's weekly virtual seminar of the Center. It's really a pleasure to have you with us today. The mission of the Center is to create knowledge about digital media in Latinx and Latin American communities across the Americas. Today's speaker is a leading scholar in this space. Carmen Gonzalez is the Dart Endowed Assistant Professor in Trauma, Journalism, and Communication at the University of Washington in Seattle. Maria Celeste Wagner, a doctoral candidate at the Annenberg School for Communication at the University of Pennsylvania and an affiliate at the Center for Latinx Digital Media, will introduce Carmen in just a minute. I'm delighted to note that this quarter, our series is co-sponsored by the Alice Kaplan Institute for the Humanities, the Buffett Institute for Global Affairs, the Center for Global Culture and Communication, the Department of Communication Studies, the Department of Radio, Television, and Film, the Latina and Latino Studies Program, and the Program in Latin American and Caribbean Studies. But before we go into the seminar, I would like to start by acknowledging that Northwestern is a community of learners situated within a network of historical and contemporary relationships with Native American tribes, communities, parents, students, and alumni. It is also in close proximity to an urban Native American community in Chicago and near several tribes in the Midwest. The Northwestern campus sits on the traditional homelands of the people of the Council of the Three Fires, the Ojibwe, Potawatomi, and Ottawa, as well as the Menominee, Miami, and Ho-Chunk nations. It was also a site of trade, travel, gathering, and healing for more than a dozen other native tribes, and is still home to over 100,000 tribal members in the state of Illinois. It is within Northwestern's responsibility as an academic institution to disseminate knowledge about Native peoples and the institution's history with them. Consistent with the university's commitment to diversity and inclusion, Northwestern works towards building relationships with Native American communities through academic pursuits, partnerships, historical recognitions, community service, and enrollment efforts. Let me say a few words briefly about how the seminar will unfold. First, Maria Celeste will tell us more about Carmen's research and career, just a few seconds. Then Carmen will deliver her seminar. After that, we will open for questions. Please enter your questions in the Q&A function of the webinar at any point in time. Maria Celeste will moderate. At the end, we will deliver some closing remarks. Once again, many thanks for joining us. And without further ado, Maria Celeste, the screen is all yours.
Hello, everyone. It is my pleasure to introduce Professor Carmen Gonzalez today and to join again the virtual seminar series at the Center for Latinx Digital Media. And thank you especially to Pablo, Mora, Facundo, Val for your work organizing this event. Dr. Carmen Gonzalez is the Dart Endowed Assistant Professor in Trauma, Journalism, and Communication at the Department of Communication at the University of Washington. Among other appointments, she's an Associate Director for the Center for Communication, Difference, and Equity, and a faculty affiliate with the Latino Center for Health. She earned her PhD and Master's in Communication at the Annenberg School for Communication and Journalism at the University of Southern California. Professor Gonzalez has a fascinating and necessary research program on issues of communication and intersecting health inequalities, with a particular focus on Latino communities in the US. Fieldwork for her research has taken place in California, Arizona, Colorado, Washington State, among other places. She has numerous publications in peer-reviewed journals, which have been supported by very prestigious grants, such as those from the National Institute for Health, the MacArthur Foundation, Google, the Bill and Melinda Gates Foundation, among others. Some of her recent projects have been on postpartum care and telemedicine, the barriers in access to cancer prevention among Latinas, and on brokering, a concept that I really like that she uses to refer to how younger generations in multilingual households help older generations access health information and resources. For many of these projects, she has partnered with community organizations and leaders in order to translate research into practice. At the University of Washington, she teaches and mentors students on communication and difference, health communication, and qualitative methods. I truly believe her scholarship is an example of rigorous and ethical community-based participatory research, and I find her an inspiring model of engaged scholarship for social change. I invite you all to share your questions and comments with your name or anonymously through the Q&A function, and we will address them at the end. Now, please join me in giving a warm welcome to Professor Carmen Gonzalez, who will present her timely and pressing work on health information access among Latino communities during the COVID crisis.
Thank you so much, Celeste. That was a wonderful introduction. I wish well, now it's recorded because I would love to hear it again. So let me share my screen and make sure this works properly. I'm looking up because I have another monitor. All right. And does that look good to everyone?
Perfect.
Okay, excellent. I'm very happy to be here, especially being able to join all the way from Seattle. This is a wonderful opportunity to connect with so many of you and to be part of this great repository that you're making to highlight Latino and Latinx scholars and the research that we do. I am at the University of Washington, and I'm going to talk about a series of research projects that are very collaborative in nature. I've decided to focus on COVID because everything is COVID right now, understandably. And there's so much of the research that I was doing before the pandemic that has kind of prepared me for this moment as a communications scholar to address pressing needs in the world around us. So this talk is about digital access in the context of a global health crisis. As mentioned in my introduction, the different projects I will talk about have been funded by both public and private agencies that are really invested, I've seen, especially lately, in thinking about how Latinos in the United States use technology and how we can improve both health and digital equity through interventions that address specific needs and build capacity and skills. I have a lot of collaborators. Not all of them are listed here, but wanted to make sure to mention my co-PIs on different projects and community partners as well. These are some graduate students in communication and human-centered design and engineering, computer science. I work with partners in public health, psychiatry, the information school. And as you'll see, all of these different expertise and skill sets come into play in the collaborative work that I do. It's also important to mention community partners. So COVID has made it very difficult to sustain the type of grassroots, engaged, community-based work that I tend and like to do. But I will show you how we've been trying to maintain that collaboration through partnerships with folks on the ground. So these are local partners in Seattle that I've worked with on some of these projects. They are all advocacy groups looking at the wellness and well-being of Latino communities locally specifically, especially kind of thinking about the pandemic and the long-term impact on communities of color. And so their partnership with academic institutions is super critical right now in order to translate all of our research into practice. And I'm very thankful for the willingness of community partners, despite all of the chaos and struggles and challenges that they're experiencing, to provide their time and expertise to work with us as researchers. So there's a pre and post COVID theme happening here, and I'll explain why I'm presenting these projects as such. I do think there was an interesting shift in kind of adjusting to the pandemic in the way that we do research, in the way that we teach, and the way that we do community-based partnerships. The first study I'll talk about is based on thinking about how Latino families use technology. And a lot of this work is built on prior work on language and technology brokering. I was a postdoc at Rutgers and the Cooney Center at Sesame Workshop before coming to UW. And I worked with Dr. Vicki Katz, who's done a lot of theory building and field work on the ways in which children in immigrant families not just translate for their parents or other adults, but really bridge access to important resources. This also builds on a lot of work in sociology that Dr. Orellana has done in how children specifically translate for their parents and the impacts that that may have in their development, especially thinking about them growing up and then leveraging that skill set that they have as they figure out resources for themselves as well. And so there's a body of work that has shown us that especially Latino children spend a lot of time and energy bridging access to resources for their parents. A more traditional deficit-oriented perspective on technology engagement would be more concerned with things like addiction to social media, screen time, the separation of the family because of technology and personal devices. And so those concerns, while important, I have found in my work and in the work of my colleagues that there's also a lot of good technology-based collaboration. There's a lot of problem solving, a lot of resourcefulness that we see, particularly in immigrant families, that we should be talking about, we should be supporting and nurturing. And so there's a debate about whether child brokering is good for those children or bad. And what I try to say is that sometimes there's no other option, right? So let's leverage that practice. Let's think about the ways in we can enhance digital literacy and bring visibility to the work that children are doing for their families and the collaboration that they often do. So we know from prior research that a lot of Latino families, especially lower income families with limited English proficiency, rely more on their kids to translate and broker information than parents of other backgrounds. They often, in the health context, help parents fill out medical forms. They might help understand prescriptions and read labels or kind of mediate health emergencies on the spot and then help parents follow up during a health crisis. So in the context of health specifically, if we think about traditional notions of health literacy, we are now understanding that the traditional measurements of being able to fill out a form, being able to read maybe health documents or brochures, that's not necessarily the way that we engage health information anymore. In this new media landscape, there's health information, personal health data kind of everywhere, right, at our disposal, sometimes overwhelmingly for a lot of folks. So if we think about health literacy as a family level asset, and that's what I argue in one of my papers, is that we can more appropriately acknowledge the ways in which different types of families work together to gain access to technology, understand how to use it, and then bridge that gap between technology use and information access. So we know that health literacy is much more than traditional measurements that are only at the individual level. At UW, I launched this project with my colleague Jason Yip from the Information School, bridging off of that brokering work that Dr. Katz had done, and I worked with her on. And we wanted to know more specifically, how are kids helping their families access this online information? So we know that they do it. There's a lot of anecdotal evidence, but there was little in the ways of detailed descriptions or observations of how exactly this happens. So during a health crisis, what technology is used? Who does what in this interaction? Are there power relations? Are there tensions? And what can we learn from that in efforts to support both digital and health literacy? Thinking about guiding theoretical frameworks for this work, we look specifically at Ehealth Literacy. So again, expanding that definition of health literacy. Communication privacy management has come up because kids do become holders of sensitive information for their families. If it involves a diagnosis, for example, they're much more privy to the details of their parents' personal lives when it comes to health. We also work off of funds of knowledge, which acknowledges that each family member brings something to the table, and that we should be respectfully appreciating the knowledge that is constructed within the family unit, and how that helps immigrant families really be more resilient and be able to access what they need. And the overarching framework that we use for this work is based on Bronfenbrenner's ecological systems theory, which we won't dive deep into, but can in the Q&A if we want to. But thinking about how digital access, really, we should be looking at so many different levels. So it's not about individual skill anymore, right? It's about, do folks have access to broadband connectivity? What are they doing with this access? What are the structures in place in the community to help reinforce that access? So this would be places like libraries, librarians, tech mediaries that can help families access information. So there's all these factors that we should consider when thinking about technology engagement, technology adoption, and specifically how families access information. So to contrast kind of concerns about if kids are doing this for their parents, if they're showing them how to use their phones, if they're searching online for them, parents might not be learning those skills themselves. We wanted to focus on that collaborative moment where there might be more back and forth between the parent and the child than we thought of. And there might be a lot of creative and resourceful ways of using technology within the family unit. We just have to observe it. So here are a couple case studies, running through the findings a little bit quickly because I have 3 projects to share with you today. But these are the most compelling case studies that I found in the context of health, right? The study looked at accessing all types of information, and I'm focusing specifically on those that concern health literacy. We have a mom and a teenage daughter, Melissa. A lot of our parent-child dyads were teenage daughter and mom, and we can talk more about some of the gender dynamics that were at play here. In this case, Claudia's mom is diabetic. And so Claudia's a mom, just talking about the grandmother, and she's worried about herself or other members of her family possibly becoming diabetic as well, because now it's in the family. She asked her daughter, Melissa, to look up how to prevent diabetes. This is a retrospective scenario that they're walking us through. They had done this in the past, not too far past, because they were currently dealing with the grandmother's diagnosis. So they're showing us how they looked up information together on diabetes. They used Claudia's smartphone, that's the mom, to find information on diabetes in Spanish. Melissa, the daughter, has trouble spelling prevention, prevenir, in Spanish. And so there's a little bit of the bidirectional language brokering that is happening. Mom wants the daughter to look up health information. Daughter needs a little bit of language guidance from mom to search in Spanish. And then mom requests the information be delivered through an infographic. She explains to her daughter that reading through documents in the moment and on her phone is not necessarily her ideal form of consuming information and processing it. So she requests for her daughter Melissa to look for infographics. Melissa knows that if she clicks on the images function in the Google search, that she will likely find information that is displayed with visuals, and that is what her mom is looking for. So we call this a specific search task that we prompted. It's retrospective, but we found out about this collaborative nature of searching that happens. And now what the daughter would probably do is pass over the phone to mom, and then if mom has any questions or wants to look for a different topic, would pass it back to her daughter. So mom and daughter are spending quite a bit of time in this moment doing these search tasks that change along the way depending on their needs. And that is much more collaborative than this idea of kids kind of going off and doing something on their own and passing down the information to their parent. In this kind of a little bit more serious, more critical scenario, we have a mom, Alicia, and her teenage daughter, again, Christina, or maybe a little bit younger. Alicia returns from a doctor's appointment and she has a diagnosis that she does not understand. She usually takes her daughter to the doctor visit with her, but this particular office that she was going to no longer allowed children to come in with their parents. That's a conversation that we can have about how and why that happens. And if interpreter services were made available to Alicia's mom, we're not certain of that. But what is certain is that she did not understand a diagnosis that was given to her in the office in the moment, and comes home and asks her daughter to help her unpack that. So Alicia's trying to pronounce liver in English because that's the word that she heard during the doctor's visit. But Christina, her daughter, doesn't understand what she's trying to convey. So she can't quite understand what organ in the body she's referring to. So they're really starting from scratch in trying to deconstruct Alicia's diagnosis. They eventually figure out through some back and forth in English and Spanish that the doctor mentioned liver inflammation specifically. So that's the diagnosis that Alicia got. And she was not provided with information in Spanish to understand what that meant, and is now having to search online with her daughter to learn more and feel a little bit more at ease about her diagnosis. Christina has to search for the Spanish translation of liver to be able to explain what the organ is. And then I believe she also looks for a visual to make sure that mom and her are on the same page about what exactly is going on in her body and where the inflammation is. Here are some quotes from both Alicia and Christina. We do separate interviews with the mom and daughter with each parent-child dyad to get kind of unfiltered, unbiased perspectives from each of them about what this feels like. The mom says there are a lot of options, and sometimes you click on things that are unrelated or that cause even more concern. This was a prevalent theme about the abundance of information when it comes to health specifically. Christina, the daughter, says, my dad taught me to look at where the links are coming from. For example, this one I can see is from the Cancer Society, and this other link, I don't know where it's coming from. She's demonstrating some health literacy skills, right, that were taught to her by her father, and she's now applying the skills that she knows in this moment of brokering information for her mom. So a lot of family assets and skills that come together in this moment of collaboration. That's why the what we call it is intergenerational online search and brokering that can sometimes be about information search or information processing and application. What we know from this study that again happened before the pandemic and we had been working on for a few years is that health literacy is a family asset, particularly for Latino families that have to navigate both technology and language and information at the same time. The traditional understandings of health literacy are just not enough to really capture the dynamics that are going on here and to develop interventions that can strengthen both health and digital literacy at the same time. So a more holistic understanding of health literacy at the family level can really help us appreciate the skills that are being at play here and the way that families collaborate. So it's less of a deficit-oriented perspective and more asset-oriented. So this symbolizes a pandemic pivot that I like to call, and that a lot of industries experience, right? We were doing community-based research on families and technology and had to quickly adapt because during the very tough moments of the pandemic with stay-at-home orders, social isolation, social distancing, we weren't able to engage our community partners in the way that we would have loved to. However, pandemic shifts don't necessarily mean that you change course completely or that you have to develop completely different methods and kind of let go of the things that made community-based research what it is right now. So instead of a complete pivot, the way that I like to think about what is happening during the pandemic is more of this pendulum shift, but always returning to that main pivot point, right? So we can't completely let go of the values and the practices that we know are important to community engaged research. It's more about adjusting to the moment and then coming back to the core. So metaphorically, and I love metaphors, to me, it's a little bit more of a pendulum than a complete, change of course. And in thinking about that, these are some of those core values in engaged research that need to stay constant in order to be able to meet the needs and address the needs that are happening in the moment. So despite the challenges of doing engaged research, we as researchers who were invested in continuing this had to make sure we were still building rapport, trust, had a lot of transparency with our community partners, held ourselves accountable to the type of research we were doing. And the most important one probably during the last 18 months or so has been the value of flexibility. So not ignoring what is happening in the world around us for the sake of academic outputs or academic deliverables, but being flexible enough to address the needs of our communities, which is not an easy task. So I will walk us through two of these instances of engaging in a rapid response project, grant, focus, collaboration to address the disproportionate impact of the COVID-19 pandemic on communities of color, but more specifically on Latinos. As we saw early on, unfortunately, the pandemic has shed light on very long-standing racial health disparities in the United States. Latino and Black residents have been 3 times as likely to become infected and nearly twice as likely to die from the virus compared to white people. Explanations for these disparities can range from social and structural determinants of health, including racism and discrimination, economic disadvantages, and an inequitable access to healthcare. And a lot of the prevalent prevention methods, such as social distancing, remote work, were unattainable to communities of color who did not enjoy the privilege of working in sectors that allow for flexibility or reprieve without dire economic consequences. So we're seeing almost this moment of nothing was surprising, right? But it was also heartbreaking to learn about vulnerable communities being more impacted and compounded by the consequences of the pandemic. Specifically in Washington, the community that we were focusing on in this moment were farm workers in the eastern part of the state, who, as one community organizer put it best, were feeling like the sacrificial lambs of the pandemic. So they were considered essential workers, but the rhetoric before all of this was that they were unwanted in the United States, and they were essential but not protected. So not given the same types of services, not protected by mandates in the same way that other essential workers were. So all of these conditions were leading to more deaths among Latino farm workers and farm workers in general. And as communication scholars, our role was and is very critical right now to be able to address some of these concerns because they're public health related, but also had so much to do with communication. And this is how communication kind of came to the forefront as something that everyone was doing in the moment, because it was really the quickest way. These are called rapid response projects because we had to figure out what the essential need was in the moment. The Centers for Disease Control and Prevention, despite having so many recommendations that changed overnight, really always came back to these communication-based strategies. Some of them were to work with advocacy groups to understand the needs of particular communities and to get community input when developing communication materials. Because mandates and recommendations were changing so quickly, this really required grassroots efforts to produce information and disseminate it in ways that made sense based on who you were working with. So communication tailoring was really important, particularly for rural residents. They weren't getting the same kind of messaging that some of our more urban residents were getting. And we had to think about developing messages that were sensitive to unique health issues, thinking about actual access to testing, for example, and lifestyle, and making sure that we were translating the abundance of information in a way that was more digestible and included action items so folks can do something to protect themselves and their families. So the CDC and a lot of public health agencies in our state were pretty quick to focus on community-based tailored communication to address the disproportionate impact of the pandemic on Latino communities. Now, talk about a moving target for any communications professional and a communication scholar thinking about how to apply what we know about messaging and about tailored campaigns in a moment of chaos, really. So because the pandemic was a moving target, you can imagine the challenge of producing information that was timely, relevant, accurate, and worked against this abundance of information and misinformation about COVID-19. We were all consuming information quickly. In the Latino community specifically, we are still in the midst of an infodemic of misinformation. And tech companies have been critiqued for not quite doing enough to help us through this and to clamp down on misinformation in Spanish in particular. There are a lot of inaccurate stories and anecdotes and narratives in applications and services such as Facebook, WhatsApp, Snapchat, Instagram that have been very prevalent in the Latino community in Spanish. And it started kind of with the seriousness of the virus, to the importance of masking or not, to home kind of remedies to protect oneself against the pandemic, against COVID-19, and now to kind of nurturing this idea of vaccine hesitancy. So a lot of misinformation at the same time that we're trying to produce culturally tailored information on how folks can take care of themselves. So not an easy task to work against the noise that, because of our media landscape, was very loud in this moment. A national survey at this time, this was in the spring of 2020, revealed that Latinos exhibited higher misperceptions about ways to prevent COVID-19 than all other groups. So what are we going to do about this? Without being able to fix the misinformation problem overnight, that's something that those of us who are working on it are tackling, but it would take a while, right? We need tech companies to work with us. So the answer in the moment in a rapid response project was to co-develop culturally relevant messages for farm worker safety specifically. This is the value of focusing on a particular vulnerable community, and thinking about the principles of community-based research to produce messages that were relevant, that were accurate and timely, and disseminated in a way that made sense for this group. So we developed a partnership with many different disciplines. This is a very interdisciplinary project. It involved the School of Environmental and Forest Sciences, the Department of Environmental and Occupational Health Sciences, social work, public health, and communication. We came together partnering with agencies who are on the ground working on farm worker rights, and agencies who were quickly trying to figure out best practices in terms of workforce safety. Some of the guiding frameworks for this work were communication infrastructure theory, which from a communication scholar perspective was really about that message dissemination. So the more that we engage with local media, with community leaders and stakeholders and residents themselves, the more effective we could be in trying to affect specific behaviors, right? So those behaviors might be wearing a mask, getting tested, and now getting vaccinated, but also being sensitive and conscious of the cultural barriers and the perceptions or the lack of trust that our community might have in the American healthcare system, in the government in general, and fear that might be building because of all of those stories disseminating through social media and traditional media as well. We developed this partnership quickly, got support from the University of Washington's Rapid Response Grants, And really this was a response to some top-down health communication campaigns that were not necessarily engaging with community partners or residents themselves to think about the actual needs in the moment. So again, I'm going to be repetitive and redundant about matching the method and the approach to the needs of the communities that we're working with. What resulted from this project, and I wish my colleagues were here to talk more about all of the work that was done on the ground at a time where many of us could not be there physically. So we're very grateful to very active graduate students that we had in farm worker communities, advocacy groups, who were putting their lives on the line to be able to get the right kind of involvement and collaborations from actual farm workers to produce these messages. What we did quickly was pick topics that were most important and most critical. For example, thinking about masks at first, despite conflicting information from the experts. And so we would produce these infographics that were disseminated through social media. We had radio spots that relayed the same information, and physical brochures, flyers, handouts that we were placing in the hands of community workers on the ground. I want to focus specifically on these social media cards that were developed. So the goal of these cards was to inform workers of their rights, to hold employers, so these are the growers, accountable to labor and industry standards and mandates, and to display kind of one piece of information at once that would help folks hold on to these recommendations. For example, we had these cards that would start with how to safely wash your hands. So one strategy that you can do as a worker, and then also as an employer, you should be able to provide that space for your workers to wash their hands. So creating access to the resources needed to perform that behavior. These are in Spanish, so I'm trying to translate. Another one might be about social distancing and thinking about the ways in which workers and their employers needed to have guidance to be able to do that properly for the safety of the workers and their families. The brilliant part of this was that it was one idea per card, and then they could be stacked together almost in an Instagram type of fashion and disseminated through different platforms. The Facebook version of this post gained over 9,000 views on our partner's Facebook page, and was the most successful product from this project in that moment. Here's, as the summer went on, now we had to worry about farm workers wearing masks during intense heat in Eastern Washington. And so we had heat experts on the team as well. And we had to think about, we're not going to ignore the fact that you're trying to wear a mask, but you also need to get proper ventilation while you're in the fields. So we would produce content based on this acknowledgement, using photos of actual workers, showing them ways to best not touch their mask too much, store it, take care of it, reminding them that we know it's hard to follow these recommendations when you're out in the field. So again, that moving target and trying to figure out the best communication strategy. There was also mixed methods of communicating a little bit of information or a lot at once, so they could kind of take it with them and think about showing information in a way that was relatable. For example, in this flyer, we had the physical distancing recommendation. We used cherry bins, and that's from feedback from the workers that wanted to know something tangible that they could compare those 6 feet to. So the 6 feet would be like 2 cherry bins. And that made it a little bit easier in the field to think about how to maintain distance. So culturally tailored, receiving feedback from the workers, co-production, and disseminated in a way that was visually digestible. This project went on to being owned by the community organizations that we were working with, is now working more on vaccine hesitancy. And so all of these materials kind of changed and developed based on what was happening during the pandemic. All right, a third study that I'll have to go through a little bit more quickly. Another rapid response grant thinking about the disproportionate impact of the pandemic on Latino communities. In this case, the focus is postpartum Latina moms. We saw a sharp rise in postpartum depression symptoms among Latinas specifically, and even less access to mental health resources for a group that is already the least likely to get help during the postpartum time, and high prevalence rates of postpartum depression, even suicide for Latina moms compared to all other groups. An existing health disparity compounded by the realities of the pandemic, including social isolation, lack of family support, fear of accessing services, and mostly a new reality for moms that were already struggling with the challenges of having a baby, but now with much less support. At the same time, we're hearing about telehealth and how great it was to bridge the access and care during the pandemic. We heard about research that found success in these trials of seeing a therapist online through virtual therapy, having psychiatrists more accessible. But as we know, we found again that Black and Hispanic patients were not using telehealth in the way that white patients were. It's not surprising for a number of reasons. One is that Latino communities specifically are not accessing mental health in the same way. And the idea of receiving mental health support through a virtual platform is still a little bit foreign for our community. Meanwhile, there are these great behavioral health platforms that are bringing mental health support and in general kind of coaching and therapy to a wider audience, particularly when folks can't necessarily see someone in person. There's a countrywide, probably worldwide shortage of mental health providers in the moment. So what we did for this project, I got an Rfp Grant from the National Institute of Mental Health to adapt an existing behavioral health platform. In this case, it was called Ginger. Ginger is kind of a one-stop shop for different kinds of mental health support. You could see an actual therapist and have regular appointments with them through the app and do virtual sessions. You can have a coach available to you mostly 24/7 that is more text-based, and you can ask a question, get some help in the moment from a behavioral health coach. And then there's a lot of self-guided content. So these kinds of platforms exist. There's many of them right now. Ginger is the one that's most integrated to have different forms of services. Again, these applications were not designed with Latinos in mind, much less specifically Latina moms, right? So this is a for-profit model, and it makes sense that it was designed with the lowest common denominator in mind to make the most money, and often those are white males, right? So there's very limited involvement of communities of color when thinking about designing these kinds of technologies. So what my collaborator and I, Maggie Ramirez, who studies user-centered design and interventions with Latinx families, we put together this project that was built on the technology acceptance model. So thinking, what are the barriers to telehealth in general and for Latina mothers specifically? Again, Ehealth Literacy, how comfortable would they be with accessing online health information? And we built this project based on the discover, design, build, test model in implementation science. Very similar to user-centered projects. Understand the needs of the population, co-design and iteratively design a new platform or innovate something that already exists. build that out and test it and provide feedback to make sure that it really meets those needs that you identified in the discover phase. This model has been really useful, and I have found that as a communication scholar, I have been able to adapt and apply communication theory in every part of this model, because it's those understandings of how folks access information, how comfortable they are with technology, that helps us design technology that is most effective. To start, this is part of the discovery phase. I'll go through this quickly and we can talk more about it. We launched an online survey, unfortunately. This would have been an in-person project with a community partner at a local clinic. We envisioned one-on-one interviews with Latina moms, and that did not happen. So we started by doing a survey focused on women of color. It was very tricky to get Latina moms who had just had a baby to do an online survey. For women of color, we saw very high rates of postpartum depression symptoms, much higher than the average at any time. And very few of them were receiving mental health care. A large portion of them had no childcare assistance, so that compounded their experiences. But high connectivity, they own smartphones, high health literacy, and high interest in virtual therapy. I want to focus on this. Again, won't read through these. These are some of the more qualitative reactions and statements we got from Latina moms specifically about how the pandemic was impacting their experience as a new mom. Some of them talked about missing face-to-face appointments with a provider, not knowing if they had postpartum depression or simply kind of pandemic anxiety and depression, and feeling like their experience as a mother had been ruined because of the pandemic. So we took that platform that existed, the Ginger one-stop shop, and then we adopted it, integrated it with online content that is self-guided, developed by Dr. Aline Barrera at Palo Alto University, and integrated those two to think about the ways in which we can not reinvent the wheel, but use existing resources that are tailored to Latina moms to come up with a new platform that might be of better service and more relatable, more accessible. The phase we're in right now is this prototyping and storyboarding with Latina moms specifically to ask them how they would feel about using something like this. So we visually create the integrated platform before building it, right? So that we can test it and getting their feedback on, would they have time to do something like this? Would they feel like they had enough privacy? Would they be comfortable? Would this meet some of those needs that they're still experiencing now because they have children who are unvaccinated at home and may not be getting social support or mental health care services? In all of this, my research right now is working to build an intersectional and participatory research and policy agenda that leverages user-centered design and cultural tailoring to better serve the mental health needs of Latina mothers. I think it's a very promising time for communication scholars to work with folks in other disciplines, to work with industry partners and community partners, to think about applying our research to inform the development of technologies that better serve Latino communities specifically. And I think it's a good time for us to bridge that access gap and to translate research into practice. So I'm very excited for what's to come. Thank you.
Thank you so much, Professor Gonzalez, for taking us through this journey where we learned about all of these important studies. Very timely work. We have a few questions from the audience. My cat wants to join as well. But I would like to start off with one question that about the first study that you talked about in relation to immigrant childhoods. So I think that it's very important what you were saying, that so many times deficit perspectives on technology and childhood, there's so much focus on alleged negative consequences of technology use. And what you're saying is that we also have to think not only on the individual, but on these meso-socialities and the family and all the work that children do for their families. So I was curious to learn more about your findings in the interviews with children on how they navigate, because I imagine it must be hard to have to read a diagnosis of something that your dad or mom are going through when you were just a kid. So how are they navigating their own mental health and that huge responsibility in doing that emotional and like very important labor for their families?
Yeah, so I think it's both a source of pride that they're able to do it and that they have the language and technology skills to be a support in that moment. But it's very stressful, and we've seen in other research on this that it can lead to anxiety in children, right? And that's understandable. And when I've given talks on this, sometimes people do tell me like, this is not okay for kids to be doing it. But what we like to focus on is that source of pride as well. So the digital literacy and health literacy skills that kids are building in these moments are actually stay with them, right? And then translate into sources of motivation, whether it's in school or in accessing other types of information for their family. And that collaboration is really, I think, more bidirectional than we had talked about before in research on brokering.
Thank you. I will now go to the question from the audience that are really great questions. So Xin Wen Sang asks, thanks for your presentation, and asks, very important and interesting work. I have a question about trust between parents and children with regard to health information. Our work has shown that in China, there is distrust between young adults and their parents on this process of sharing health information across generations. So have you observed anything like this in this context?
Yeah, so there was interesting moments where we saw kids mediating health information for a sibling, for example. But I never saw an instance in our work where these were teenagers often, where they were sharing their own health information. So maybe in that sense, there would be less trust in kind of opening that up to their parents. And on the side of the parents, there were some of them that commented that said, this is codependency. Like, this might not be a great thing. And I wish I didn't have to tell my child that I'm going through this health situation. I wish I didn't have to do this. And I do have to trust that they're going to almost even keep this to themselves, right? Both parties. But surprisingly, maybe because we didn't ask about trust specifically, I didn't find a lot of that, as much of that as I would have expected. It was much more framed as this is what we do as a family, and we do inherently trust each other to be able to support our needs in these kinds of contexts.
That's very interesting. David Alvarez asks, why were there so many daughter-mother discussions about health in the first place? What are hospitals doing and other healthcare workers to make health more accessible, especially in households where English is not the primary language? So what happens before that conversation needs to happen?
Yeah, and so this is not to say that, you know, there's a lot of folks, and I do some of this too, that we're working on interpreter services and language access. And there are mandates and laws that protect individuals from being able to have the help that they need in the clinic or in that provider interaction. But what we found is that, again, in our study, that parents were not necessarily asking follow-up questions, either because they weren't comfortable with the form of interpretation or one was not made available. And so there's a lot that happens at home because of this information searching, and because they know that they can learn more in the privacy of their home at their own pace, using the technology that they're likely already using for other things. And so maybe there's more private health information seeking than there has been in the past. And probably parents are doing it on their own as well. It's just in these moments where they need assistance that they're turning to their kids.
Yeah, that's very interesting. Susan Martinez asks a different question that's more related to concerns about information, like the content that you can access going online. So a website to access information can be confusing, inaccurate. Do you provide recommended sites to visit in the Spanish language as part of your research?
Yeah, so what we do, we haven't done these lately, again, because of the current times, but we do these family health literacy and tech literacy workshops, and often focus on health as one of the topics. And so we bring together students, undergraduate and graduate students that work in computer science, information, and bring parents with their kids and have them either bring devices or we provide them. And then they tell us what are the things that they're working on right now to access as a family. And we do skill building. So that takes a lot of energy to do that. I don't think we're doing a great job of leaving resources behind in terms of the work that we did, but at least those family workshops, when we can do in-person things again, we do want to continue doing more of that.
Yeah. We have another very good question from Andrea Otanes, and says, your work is so important and inspiring. Can you talk through your process of getting families welcoming you and your collaborators in, especially given the intimacy of the subject matter? Yeah, I was thinking about that too. Like, how do you build rapport and how do you build trust in this, in these situations?
Yeah, and that's the case when we were going into homes in person, and it's still the case when you call a mom who has a baby at home and you ask her to talk to you about how she's feeling and if she's accessing mental health care. That takes a lot of rapport building. What we do in these projects is we partner with community organizations who might have relationships with the folks that we're trying to reach, and they often bridge that initial connection. So that's one strategy and really an inherent nature of community-based research, right? To work with community organizations and not necessarily go directly to the folks, because I might be Latina, I might speak Spanish, but I'm a researcher and I do have to present myself as such. And that can be a big barrier to somebody trusting me. So they will welcome me into their homes, but it takes a lot of connecting as a person to have people open up and share their stories with us. Yeah. It's not easy.
Yeah, no, I can imagine, but it's clear that you are doing a good job, like collaborating with these community organizations and with families too. So we have one last question and we have 2 minutes. So this will be our last question probably. Lucia Magis Weinberg, she asked, do you find intergenerational differences in how parents and adolescents define and understand health, well-being, stigma?
Yeah, definitely. I wish we had asked more about stigma specifically. That's coming up now in our work on postpartum depression. But these are mothers that we're talking to and they have babies. When I think back to the work with kids, so we do the separate interviews intentionally to see if there's conflicting definitions of not just brokering and technology use, but these moments of health information seeking. And it's interesting that the things that seemed very critical to parents were seen as just another day in helping their parents access information for the kids. We had kids as young as 7 years old, 8 years old, who were doing some of this. The more sophisticated health searching were the older ones, but even the younger kids, it was just a thing that they do, whether it's helping their mom, figure out how to put the passcode on the iPad, or whether it was helping her get to a page that she needed to research something. So parents were grateful and almost wanting to do this on their own when it came to health. And kids, even if they were very critical health moments of brokering, were seeing it as part of their realities of helping their parents and feeling proud of that, right? So we shouldn't ignore that they actually feel good being able to do this and to make their parents feel more comfortable and to show them that they have these language and tech skills. It's almost like they're showing that off to their parents.
Yeah. Thank you so much, Carmen. It was a real pleasure to hear you. And I don't know, Pablo, if you want to say some closing remarks.
Just thanks again, Carmen. This was absolutely not only very fascinating intellectually, but very, very important and relevant socially. So I want to thank you again for sharing your work with us. I want to thank Celeste for her always outstanding moderation, and the audience for great questions, very engaged audience, staying with us through the end also. So, and I invite everybody to join us on Thursday again for another installment of the virtual seminar series of the Center for Latinx Digital Media. Thank you very much again, Carmen.
Thank you so much.
Thank you for having me.